So he will leave for Arizona on Friday, right? Paul, I'll see you. All right, how are you?
How are you, sir? You okay?
Dr. Gulani.
Yeah.
Pleasure meeting you. How was the trip from London?
Yeah, it was very long, 20 hours.
That's what the other London patient just said. Yeah. Take a seat, we'll see shortly, right? Wonderful.
Yeah.
So here's another patient. He is also from London, Manchester area, right? And he is here today, a vision of 2400, basically legally blind. And quick, your history, please. You've just arrived, and I've been spending how much time already? An hour? Measuring and refracting. But quick history, please, because I let doctors watch everything impromptu here.
So I'm from Manchester. I've had cross-linking done in 2018, and year after intacs in 2020. Then I was just, the doctor just said to me, right, you just got to live on hard contact lenses. And they discharged me from there. And since then I've still just been fighting for vision. And I've been looking into Dr. Gulani for a long time.
Stalking me.
Stalking
Stalk
me.
me.
That's it, yeah. And
not research.
Yeah, and I've been watching all the videos thoroughly, day in, day out. And I thought, all the stories are here and that, and I made the right decision to come here and to get this fixed, because I know that Dr. Gulani is a man on a mission to fix your vision.
Well,
yes.
It's my pleasure. So doctors, again, what you're seeing is no matter how difficult they are, or how many surgeries they've had, or how far they've come from, my fight starts with refraction. I want to see the vision potential. I call it the gold, right? If he has the gold, only then will I proceed, because showing them my surgical powers doesn't make sense if there is no potential, right? So I have refracted him myself for over an hour. Now I'm going to see the potential of his vision. Are you ready, please?
Yeah.
Here we go. So can you see that, please?
Yeah.
And his vision is 2400, and I actually think he will go down at least to 2440, which I will find out and see if he's true on that vision. All right, go ahead, please.
H. SVN.
Fast.
ZCD.
Wow.
KSROH.
And doctors, I'm always listening to the volume because that tells you confidence. He's not going It's a strong voice. That means he can really see. I'm watching all that. Go.
CDZKV.
Come on, man.
RHOSZ.
Come on.
OZDVK. RHKSD.
Make my day.
SVHCZ.
Have you ever done that?
No, never. Never used them.
Have you ever done that?
Never, honestly.
Amazing. Come on. Pushing you. Don't have to.
VDRDH.
So around that, right? So that's where he's struggling. Keratoconus is extreme, intacts with scarring, and high regular astigmatism with cross-linking done already. Now what I'm going to do is I'll take him to a line which he could see, and I'll do my $1 million test. Is he really seeing? What's the perception? Should I allow him to have surgery with me and spend monies and have surgery and go through it, all right? So now tell me, how do you see it now?
Nothing.
And now I'm going to show him with the numbers I've planned for him. And now.
Yeah, very good.
On a scale of 1 to 10, how much better would you say this?
10.
So doctors, even though he's not 20/20, that gives me the reason to say yes to him for surgery, all right? Anything you want to say for having come here all the way?
Yeah, we've come here all the way and we've seen Dr. Gulani's videos and everything, but it's been very nice meeting him face to face, and he's very, very passionate. And where in the UK they just say that's it, we can't do anything. As soon as we come here, he come to receive us, and we've got faith in him. He'll do his best, and very passionate for his work,
Yeah.
which actually boosts our confidence as well.
I'll do my best to try, but this makes me happy. It means you have potential, right?
Yeah.
That's why I'm going to fight for this. Let's go. I'll torture you some more.
Yes.
All right.
Ready?
Come on. Okay, great.
Yeah,
I
so-
have everything.
I've been past Dr. Gulani for past 5 years.
5. Not researching. You guys are stalking me.
Stalking him, yeah, day in, day out, And I've travelled all the way from Manchester. I've had keratoconus for about 17 years. Then my progression of keratoconus started getting worse around about 2014-15. Then it was just obviously getting things done at UK, Manchester. All they did was cross-linking. 2018, 2019 they did the intacs and just left me blinded, saying now you just got to depend on the glasses. And it was horrible, And So today at the Gulani Vision, you know, doctor spent good 3 hours searching for my gold.
Gold,
And
yes, I love the word, the
you know,
vision.
and we're there, and I'm very happy that I've even picked up his words even before coming here, right? You know, so I'm just very happy to be here and to be in the best of hands.
Thank you.
Yes.
More important, doctors, y'all are watching Impromptu all day as I'm rechecking everybody prior to surgery. And I love the fact that patients are now even using the words that I've been teaching. I really appreciate. And it's tough to see, it's sad to see that y'all are trying to become doctors. This knowledge should be given to you. So I love that. And the gold he meant, as you all know, is the potential vision that I look for, that I showed you in the video prior. Here he is with his eye cross-linked and intact surgery done. You can see the 2 rings here back in UK. Vision 2400 being left for hard contact lenses. What options were you given at all, Arif?
Nothing much.
And you can see the Panacami XL wave. You can see the channels of the rings here. Very high regular astigmatism in the eye. And you can see the eye trace here, also showing you extremely steep cornea. The very distorted vision on this map that we have the dysfunctional display of each portion of the eye, the cornea, the lens, and the overall vision. So despite all that, you saw me go with the refraction and make him see. That is the big thing that I talk about always. Refract the patient and make them see. We'll do that. Arif, are you ready?
Yes.
Come on, let's go. Wonderful. Excited?
Yes, I am.
Guys, come on this way, please. Say bye-bye to everybody.
Bye.
This is Arif, Alex. Come on in. Yep. So you can see in this case of intact placed in both segments here, very irregular reflux, very poor vision. We'll be performing LenzOplastique on this case. Thank you. 2, Arif, here we go. Very nice. Excellent. Very good. Wonderful. Very good fixation. Wonderful. Wonderful job. 10 seconds. Excellent. Great fixation. Wonderful. Great job. 2, 1. Alright, Arif, I've just finished doing LaZrPlastique on your previous surgeries that you came here with, all the Ferrara rings and intacts and the cross-linking. Can you tell any difference, please?
Yes, I can. The light looks a lot clearer.
Wonderful.
No pain.
Super. You guys have all watched these videos of mine before flying over, right?
Yes, yes.
Day in, day out. A pleasure. And this is a wonderful gentleman who has traveled from Manchester, United Kingdom, with the Ferrara intact rings in place with cross-linking with very high regular astigmatism and scarring with very poor vision. And we just finished doing LenzOplastique on his eye. You can even see the perfect circle of sight, as I call that, and always translates to vision. Right? Beautiful. Anything you would like to say with your experience here, right?
It's been a great experience. Doctor's been brilliant, staff, everybody. I just don't have words, you know. It's so wonderful. Yeah. I'm just very lucky to be here.
A pleasure. Congratulations, safe travel back to Manchester. The reflex right there in this very complex case of Ferrara intact rings that he has had before coming here, along with cross-linking and that scar. You can see the rings in place right here. You can see both the rings in place right there. Excellent. Very good. Wonderful. Manchester. How do you feel?
Yeah, I feel good. Yeah.
Any pain at all?
No pain, nothing.
How long was the surgery?
It was like 5 minutes.
5 minutes.
Yeah.
Very good.
How many hours did you travel for this?
Oh, over 20 hours by the time we go.
We had a number of patients from London area. But a pleasure. Can you tell any difference in the operator?
Yeah.
Yeah?
Yeah.
And you saw the complexity. He's had previous surgery in London and you saw the rings were there, the scar, the cross-linking, but very proud of you. Get some rest now.
Yeah.
Good job.
Thank you very much.
Have a good pleasure. God bless you. Come on. gentleman has traveled from Manchester, UK. You can see they did this intact Ferrara ring concept on his cornea and cross-linking and left him blind, right? And we've done LaZrPlastique yesterday. See, there's no evidence of surgery. Eye looks perfect, right? And more important, I asked them about pain, remember? Sit back. Right, any pain at all?
No pain, nothing.
And this is surface laser surgery. People keep talking about pain. None of our patients for over 2 decades, I've been recording them, have even on asking, right? And all of them have had surgery. All of them are very intelligent, but no pain. How would you describe your experience here, Rafe? Today's day 1 after your surgery.
Honestly, excellent, brilliant, in the best of hands. I always said he's the man on a mission to fix the vision, Yeah, and it's been really, really good to be here. And the staff have been brilliant. Dr. Gulani spent loads of hours with us. And honestly,
All of you are
there's
traveling
no
back.
other doctor who spent that many hours with me as Dr. Gulani has, That's what makes him different. Yes.
Pleasure. All of you guys are now traveling back home. Meet at the airport and talk bad about me.
Never.
Some people were like adjacent in rooms, at the
Yeah.
Ritz and Marriott and all that.
Yes.
So they met for dinner yesterday. And like, I
Alright.
told you, don't open your eyes. It's like, okay. Great.
Hi, so I'm Arif. I'm from UK, and I've had keratoconus for the last 17 years. I've had 2 surgeries done in UK, cross-linking, entice which failed, left me blinded. This is my first day after surgery with no pain, nothing whatsoever. And I met lots of patients all around the world. We shared our stories and everything, and everybody's so happy that they found Mr. Gulani. Like myself, I did lots of research and watched lots of his videos, and everything was positive. So I had to come here, and I've had LaZrPlastique done yesterday, and honestly it was just like 4 minutes, 5 minutes thing, and no pain, nothing whatsoever, and you start seeing results, and over the time everything's going to get better and everything. So yeah, I'm very happy. And Dr. Gulani, like I always say, is a man on a mission to fix your vision. So if you have any complications where other surgeons say no to you, that nothing can be done, there's one man, Dr. Gulani. He's here, he will help you. So just go for it like I did, and the rest of the people who travel all around the world. Yeah, so just be positive, and thank you. The other thing I love about Dr. Gulani is that he spends so many hours with you, discussing your plan, everything. Like the surgeons I've seen in the past, it's like you're waiting 2 hours, and when they call you in, they only speak to about 5 minutes. But with me, Dr. Gulani, you waiting there 5 minutes, you go and see him, he's there with you for 3-4 hours talking to you about your plan, everything what he can do. That's what makes him special. He listens to you. He listens to you very, very carefully. Where I feel though, as if other surgeons who dealt with me, they haven't really listened to me as they should have done. And this is what makes Dr. Gulani very, very special, because he's a listener. He gives, and everything, he gives his 100%. So I'm very happy to have Dr. Gulani to deal with my keratoconus.
Come on, join them.
Yeah.